Any joint could be affected with arthritis and leads to debility, loss of man hours, loss of freedom. One fails his activities day in and day out, maybe professionally and even sometimes psychologically, and they are deprived of their routine life, which otherwise would have been enjoyable with no pain in the joints. The roadmap of the study that has been conducted regarding arthritis and rheumatoid arthritis taken as two topics here, where suffering is most frequent and most often. It is debilitating sometimes. With the current options and limitations that we'll go through, let us go ahead. Though a small joint is shown here, it is not only the small joints, the large joints, the joints of the flat bones, maybe the neck. Everywhere one could have an ache because of ailment of the joint. Rheumatoid arthritis per se is very, very seriously debilitating, more so than osteoarthritis, unless it is treated in different modalities. Not only medication but even palliative therapy does need to be supported. Here you see how the process of arthritis develops and progresses. There are tumor necrosis factor alpha and interleukins which play a major role in causing the problem, and how to get out of the situation we'll go through. There's actually a video here. I don't know if I can play. I'll try. I don't think I can get it here. No. Anyway, let's go ahead. Then, as osteoarthritis, it is not that very quick disease, but it is a progressive disease over times. Maybe it takes years. Sometimes it really does not affect some people, but affects some people, a few of the population, to such an extent that they cannot progress well in their routine activities. Here we see what we often say is synovitis, articular cartilage damage, are the often words and the terminology that we come across in most reports. Then pathophysiology is essential to know the disease and to study the inflammatory process and how to get out of those inflammatory process. Disorders due to various deficiencies that one might find in the system. Not everybody suffers, but some people do suffer to a very great extent. This is all chemistry. I don't think in the middle of the night I should go much into the chemistry, which anyway will not be that very necessity to know, but I would like to highlight more onto the idea today why I am here. How to manage arthritis innovatively. Curcumin has been defined for a very long time, expecting a great relief towards arthritis, maybe rheumatoid or even osteoarthritis. It has such potential properties in alleviating inflammatory arthritis. It is a wonderful antioxidant and anti-proliferative and analgesic also. It has such analgesic properties that NSAIDs may even be avoided sometimes. Some people do respond so well that just curcumin would be enough to handle their arthritic problems. There are various studies done across the country by Cadila as an initiative, and 35 still ongoing trials across the country where the samples are given exclusively for about 2 months doses. For 2 months a patient gets free dose, and subsequently once they find relief, usually about the 20th day one would find relief, as I have been trying it, and they feel that they will be able to buy the product because of the benefits they find by using it. It is a bit costly now, but in the long run we think it will come down in the price as well. Then it has multiple sites of action, but the natural available curcumin would not be as effective as the modified product that I would show you here, what has to be done to it. There are several studies with and without NSAIDs, maybe diclofenac, maybe methotrexate, like in rheumatoid arthritis, and whereupon one finds a quality of life improvement in an overall situation. These are compared to studies with ibuprofen, also with and without ibuprofen, where curcumin would be continued after 4 weeks by not taking ibuprofen further. Incidentally, I do not have any clinical pictures here to show you where the changes are so very grossly found by situations where only NSAID irritation does not cause any secondary effects, does not affect the effect of other drugs, and basically it is not metabolized in the body. So a novel form of curcumin has to be introduced to get the efficacy of the drug to have a better effect on the treatment. Conventional curcumin has such limitations that it is not soluble in water. It repels rather. So we need to make something to bind, allow it to bind to water so that it is absorbed and it reaches the site of action where it is intended to. Often even 12 grams per day have been used as natural product, but the efficacy is very, very doubtful. Then bio-enhanced modified curcumin has such effects that it binds into nano-sized droplets where it penetrates through the GI mucosa, and any membrane it is permeable to. It permeates into any membrane, and the bioavailability is such tremendously enhanced that the sites are reached very easily without any additives. So these are the studies and parameters recorded as oral form and even topical form. Here when we do not need even 100 milligrams per day per person, whereas in the natural form even 12 grams were tried and attempted to achieve marginal results. Even 400 milligrams per day of the enhanced variety is found to be safe in a period of about 3 months. So the suitable option for monotherapy as well as combination therapy has been studied, and monotherapy is very effective in patients who are sensitive to NSAIDs. Then with this product, the management of osteoarthritis and rheumatoid arthritis is much encouraging, and the patients come back better. Every visit they come to you, they say they have increased mobility, they have relief of pain, enhanced activity, and back to life to perform better roles of theirs. And some people say that I thought I would end my life, but today I feel much better because of the new product that you shown me, though I have been using for years together to get some relief where I could not really find any. So let's make life a pain-free and joyful event. So with this, I introduced you to the new product, the bio-enhanced curcumin, which maybe if you have samples, maybe you can see some. Anyway, you can have it in a week so, once you're back to your office. And I would like to say that I have been a proud partner of Cadila for the last 3 years. I was unfortunate not to see the icon. It was just 6 months later that we had a seminar in Ahmedabad where I could see the Lotus House. I was there for 2 days, It was a fantastic experience talking on non-operative methods of osteoarthritis. As today I was asked to be a guest there, but I denied because I don't go to any place unless I am asked to speak. So they found me a slot, and that way we are associated, and I think we shall do more wonders talking to you all and inviting you all into the conclave of innovation. Thank you so much.